Most thyroid nodules are not cancerous. But here's the scary part. The dangerous ones do not cause any pain in your thyroid. They do not give you obvious symptoms. And unfortunately, your thyroid blood test results do not tell anything about the dangerous thyroid nodules. So in today's video, I want to talk about something very important. When you should actually worry about thyroid nodules. What are the warning signs that doctors look for in thyroid nodules? And what does your ultrasound report really tell you about thyroid nodule? And more importantly, what you can do today to reduce the risk of turning this into a dangerous nodule. But before we move forward, I want to tell you this video is not about creating fear of thyroid nodules. In fact, as I shared with you before, most of the thyroid nodules are non-cancerous. But at the same time, several people ignore warning signs of thyroid nodules. And more importantly, they do not do anything to improve these thyroid nodules. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician from US. I help people improve their chronic diseases by making personalized functional medicine plans. All right, so you have a thyroid disorder and you got diagnosed with thyroid nodule. And the next question is that what you should do about that thyroid nodule. First of all, let's talk about the warning signs and symptoms about the thyroid nodules. The first warning sign or symptom is that if your thyroid nodule is growing rapidly. Majority of the thyroid nodules grow very slowly. But if you suddenly see a lump in front of your neck which is getting bigger quickly, or you feel that your neck area is getting fuller, or the necklace around your neck is feeling uncomfortable, then this needs evaluation. What that means is that you need to see your local doctor immediately and get another ultrasound done. And here's very important information. A lot of thyroid nodules are not painful. So don't get fooled that your thyroid nodule doesn't have any pain into it. Whether it is painful or not painful, a rapidly increasing thyroid nodule needs to be evaluated. The second warning sign or symptom is that if you have trouble swallowing or you feel pressure in your throat, because your thyroid is very close to your food pipe, and when this thyroid starts growing it can push on your food pipe and can lead to these kind of symptoms. So again, if you have trouble swallowing or you feel pressure in your throat, then this nodule needs to be evaluated. The third warning sign is that if you feel any enlarged lymph node in your neck area. What that means is that besides your thyroid gland, if you feel any lumpy feeling in your neck area, whether it is small or big, whether it is painful or painless, then it can be a lymph node which is enlarged. Sometimes they are present on the side of the neck and sometimes they might be in the collarbone area. Yes, enlarged lymph node can be because of infections too. But if it is because of infection, they will go away quickly. So if that lymph node is enlarged and not going away, then your thyroid nodule needs to be evaluated. The next sign or symptom is that if there is a voice change. What that means is that if you feel your voice is getting hoarse, raspy, or deeper in nature, or simply you feel that this is not your normal voice. The nerves that control your vocal cords are very close to the thyroid gland. So when again thyroid glands get enlarged, they can pinch on these nerves and that can cause change in your voice also. So if you see any change in your voice quality, you need to get your thyroid nodule evaluated. And the last thing that you need to know, specifically if you do have Hashimoto's disease, that you need to pay close attention to your thyroid nodules, because unfortunately certain research studies do suggest that having Hashimoto's disease increases the chances of thyroid cancer. Again, very important to know, not each and every Hashimoto's disease patient get thyroid cancer. What I'm just saying is that do not ignore your thyroid nodule, specifically if you have Hashimoto's disease. And second important thing to know is that your thyroid blood work doesn't tell anything about thyroid nodules or thyroid cancer. It is only telling us about your thyroid functioning. So if your TSH, your T3 and T4 are within the normal ranges, that doesn't mean anything for your thyroid nodules. The only way to know about thyroid nodules is by doing ultrasound or biopsies only. Now let's talk about certain warning signs that doctors look for in ultrasound reports. The first suspicion signs could be microcalcification. Whenever there is microcalcification mentioned in the ultrasound report, that is considered a suspicious feature. The second suspicious feature is that if they are seeing any enlarged lymph nodes around your thyroid area. The third suspicious feature is that if it is mentioning that the thyroid nodule has an irregular margins. Now again, it is very important to know the features I mentioned over here just increases the suspicion. These are not diagnostic criteria of cancers. It is just that whenever there are multiple suspicious signs on your ultrasound, then the doctor takes these nodules seriously and then he might order a biopsy for you. And then the biopsy results can either show they are benign or either indeterminate or suspicious or malignant. If the results are benign, that is good news that they did not find any cancer suspicion over here. But if the results are indeterminate or malignant, then they will decide what next steps can be taken about it. So the goal of sharing all this information with you was to know the warning signs and symptoms and what your ultrasound results or your biopsy results might mean for your thyroid nodule. But now you might be wondering what you can do actually to help improve your thyroid nodule. Well, there is no one particular medication or one particular supplement that will get rid of the thyroid nodules. But yes, research does suggest that there are certain things which can definitely help preventing thyroid cancers. First, what you can do is that you can help your thyroid to function better. And your thyroid needs some specific vitamins and minerals. Specifically, it needs zinc, selenium, L-tyrosine, and little bit of iodine. All of these minerals reduce inflammation in your thyroid, also help functioning of your thyroid better. And that way you are getting your thyroid much stronger. So it is a good idea to include these minerals in your diet or as a supplement form. I have created this thyroid balance supplement which has all of these minerals and vitamins in the right form and in the right quantity to support your thyroid. The link will be in the description if you want to buy it. After that, the next step is reducing inflammation in your body. Whenever there is thyroid problem, it does create inflammation, and inflammation has been directly linked to cancer. So the more you work on reducing inflammation in your body, the more your thyroid and your body gets healthier. What that means is that you do an anti-inflammatory diet as well as include specific herbs which reduce inflammation in your body. Those are turmeric, ginger, boswellia, quercetin. These are great herbs which are going to help improve your inflammation levels, also help support your thyroid gland. I have created another supplement called InflammaPro, which is a combination of all of these anti-inflammatory herbs. If you want to buy it, the link will be in the description. The next important thing is that make sure you support your gut health also, because gut plays a very important role in rebalancing your thyroid hormone, as majority of the conversion of your inactive thyroid hormone, which is the T4 to T3, happens in your gut. So make sure you are eating fermented foods which are high in prebiotic and probiotic to support your gut health. That will eventually help your thyroid health also. Along with doing these things, make sure you are following with your regular doctor to get proper follow-ups done of these thyroid nodules, whether that requires regular ultrasounds or maybe regular examination with your local doctors. I have created another video on thyroid nodules and specific remedies which I have shown in research studies to improve these thyroid nodules. The link will be in the description if you want to watch that particular video also. So in today's video, I wanted to give you a message that not all thyroid nodules are cancer. But it is also very important to know that do you have that suspicious or warning signs or symptoms of dangerous thyroid nodules? And if you do, what you need to do next, first of all, to get them completely evaluated, and at the same time, what you can do on the natural basis as a prevention tool. This video I made mainly for educational purposes. This doesn't replace any medical advice that you should follow with your local doctor. I hope you like this video. If you do, please make sure you like and subscribe to my channel so you keep on getting this kind of great information in the future also. Also share this video with others who might benefit from it. Until next time, take care. Bye-bye.